with any type of estrogen, you want it to go in topically. Okay. And the
Mhm.
reason why that is because you want to bypass liver and gut metabolism, because that's where you can end up with estrogen metabolites that are more problematic, the estrogen metabolites that we don't want to see. So,
Got it.
estrogen transdermally through the skin. Okay.
Mhm.
Progesterone can also be transdermally through the skin.
Welcome to the Precision Total Health Podcast, your go-to resource for high-value, no-fluff episodes that give you the tools to optimize your health and perform at your best as a mission-driven female leader. I'm Lori Aikman, former college athlete, seasoned nurse practitioner, and founder of Precision Total Health, a concierge functional medicine practice. Let's get started. Today on the podcast, we have Dr. Jennifer Cardinal. She began practice as a chiropractor in 1997 and then completed a postgraduate certification in functional medicine in 2020 and has not looked back since. Love it. Dr. Cardinal is certified in bioidentical hormone therapy and is a member of the Menopause Society. She is happily married to her best friend for over 21 years. She is a proud mom of 3 now adult children and 2 kitties, and is learning to embrace all things midlife that no one prepares you for, from empty nesting to postmenopause and becoming more of who she feels God has created her to be. Love that. Welcome to the podcast today.
Thank you for having me, Lori.
Yes, yes. So we were just talking before, but let's dive right in. I'd love to know. So you had been in practice as a chiropractor since 97. What was it? I'd love to hear how you found functional medicine and then what made you decide to make that change, in 2020.
Absolutely. And I love that you asked me that question. And I feel like it has a lot to do with my website name, which is Hope Health Wellness. And so I believe it always starts with hope. And I feel like I can relate to that very specifically because I did struggle with chronic migraines for years. And as somebody who had a background in the healthcare world and as a chiropractor, one of the things we often help patients with is migraines because there sometimes can be a musculoskeletal component that can contribute to them. But nonetheless, even though I was able to help people, it didn't seem like I was able to help myself. And so that kind of really led me down the path of functional medicine and had a large part to do with my inspiration to get my certification. And a big part of my story was hormone regulation. And that was uncovered through the process of functional medicine and really what led me here today. So I feel like, as healthcare practitioners, I feel like it's so important to have empathy for our patients. And I think nothing drives empathy as much as like knowing what it's actually like to walk through something. And that's
Right.
really what drives me, I feel like, in my passion towards helping other women that have maybe not the exact same story as me, but similar story.
Right. Oh gosh, we are migraine sufferers in my mom's side of the family. So how are your migraines now through your process?
They're so much better. And this is something that I try to talk to patients about. And I always say, I don't have a magic wand. And, until we get to the other side of heaven, things are seldom going to be perfect. What we're looking for is things to get better, to improve, for you to function better, for you to feel better. And so my migraines now, oftentimes I can't even remember the last time I had one. So I think that speaks for itself.
Right. Wonderful. Oh my gosh. Yes. I'm in the middle of helping my mom personally right now through
Yeah.
hers because we did hers improved a lot with improving her gut health
Oh, yeah.
previously, but then they kind of recurred. And so yeah, she's gone from her high the worst her migraines were like 21 migraine days a
Oh, my
month.
gosh.
A month. Like a third, I mean, or not more than that. That's like the majority of your 3/4 of your month is
Yeah.
spent
Yeah.
with a migraine.
Well, and those of us who have migraines, like we really know that it's not just the day of the migraine, but there's also the migraine hangover afterwards. So yeah, if you're
Right.
getting like 20 or more a month, it's like you're in survival mode, and that's no way to
Right.
live.
Mhm.
My heart
I
goes out
know.
to her.
Yes, yes. So hopefully we've uncovered some things like looking at detox and stuff. So
Yeah,
I'm hopeful we're in the middle of taking her through gut again right now and then moving on to supporting her some of her
good.
detox pathways more
That
specifically. So anyways.
Yeah, that was a big part of mine too. I was estrogen dominant, poor methylation pathways.
Mhm.
So, yeah, so
Yeah.
detox was big for me.
Yeah. Love that. Love that. I know, and it's we can speak on that for a minute. I mean, I talk to so many people. I don't know about you. I get a lot of people that are like, okay, it's food, and I thought that for a while too. If I can just figure out what my triggers are and avoid them, then that will fix it, And just realizing, okay, well, it's not just. I mean, the triggers do make a big deal, or these food sensitivities, but that's not really the root cause, right? That's not really taking care of the problem. Just removing. I've found that to be if
No,
I do have foods that trigger for me, but it's not just like, oh, those foods are bad and I just need to avoid those foods.
no, and we know, I'm sure you know this in practice, but if somebody like has a lot of food sensitivities, it's usually because of a leaky gut situation. Like,
Right.
so
Yeah.
the gut is you follow it downstream, there's likely a gut connection.
Right. Yes. Yes. So that's kind of your start. You said, just kind of uncovering the hormone imbalance. So who do you work with? I think you've said some of your areas of expertise are women's hormonal wellness, gut health, thyroid health, and even just more chronic health challenges. Like who are the women that are in your practice that you're working with?
So, although I always say I see men and women and
Mhm.
all ages and all different health conditions. By and large, my practice is mostly women who are perimenopausal and menopausal, or just women with hormone dysregulation in particular. That definitely comprises the majority of my practice. And I just seem to have like a heart towards women in general. So, but
Right.
I will accept a male patient
Yes.
as long as I think I can help him.
Well, I wondered too, in that same, I see, I would say similar population in my practice. And sometimes I think too, where culturally we know like, okay, there's hormone imbalance, right? If my hormones are off, they could be causing these symptoms. So I think even if you don't know what functional medicine is, there's this awareness of there must be a hormonal problem. I think maybe if we were like, and so I think that drives women to go seek help of like hormone
Yes.
imbalance, hormone imbalance. So that's what I find I see a lot is it's got to be my hormones, which it is, but then there's generally more to the story, right?
Yeah. So, one of the things that I try to explain to my patients, and I'm sure you probably do the same, Lori, is that hormones aren't really like a root cause issue per se. If hormones aren't happy, it's like they're kind of like, I don't necessarily like this example, but I always say they're kind of like the bratty kid in the room. Like if your hormones aren't happy, nobody's happy. And so it is one of the things in the body that if the hormones are dysregulated, if you can like work towards addressing that even while you're working on root cause issues, because healing takes time, and so sometimes can take a minute or two to dial out those root cause issues. But if you can address some of that hormone dysregulation in the meantime, you usually can get people feeling better and functioning better.
Right, right. Yeah. Now, what's your take? You and I chatted a little bit before. You do work with a lot of bioidenticals in your practice, right?
Yes.
Okay.
Yes, I do.
So do a lot of women come seeking like I find I
Yes.
hear that a lot of like I don't they're concerned about cancer risk and whether it's
Yes.
okay and safe to take hormones. Like what kinds of questions are you getting from women that are coming in and seeking your help about maybe hormones specifically and HRT?
So, especially as the member of the Menopause Society, I definitely get a lot of women that reach out to me specifically for that. And most women that reach out to me, like they've done their fair share of homework. So, they usually have more of a broader understanding than kind of like what I call the old school knowledge, where there's kind of like a lot of this fear base around HRT therapy. So most of them are already like warm and receptive to it. And so they're coming to me specifically for that reason. And then, sometimes we're going to dial out some of the questions. But for any of your listeners that are listening today, the big thing that I would say is if you have questions around the safety and efficacy of using HRT, is to become familiar with the Women's Health Initiative study. And that was a study that was done that at the time of the study they did it, it was a study that was done because of the aging population, and they wanted to understand how to prevent women that were going to be coming of age and how this could potentially tax the Medicare and our healthcare from a financial basis specifically. So they started looking into the benefits of HRT, and there were some information that came out in that study that looked like there were potential health consequences of it. Cardiovascular and cancer specifically were some of the biggest fears around that. But very soon after the study, even the results of that study, they kind of came back and they debunked it. And they said like, oh, wait, there were actually problems with the study, and it actually wasn't all this bad stuff that we thought it was. But what had happened is the train had kind of left the station. And then for years and years following that, we've just been kind of living in the aftermath of that. And so there's been just a lot of kind of like disinformation, not only from a patient perspective, but from physicians as well. And I truly do feel like I think this is such an exciting time that we're living in, because I feel like it's a hormone revolution of sorts, and women are kind of starting to like take back the reins. So I love it, because I just feel like I have women reaching out to me who are like coming from this point of like wanting to be empowered and wanting to be educated and wanting to make the best decision for them. And that can include the use of bioidenticals. I feel it should be a personal decision, and that if you are somebody that is, helping somebody with the question of bioidenticals, it's about exploring like what their health history is, what's going on with them, whether or not that makes sense for them or not. But also, and I think when we first talked, I remember having this conversation with you, is that although there are wonderful things about bioidenticals, and it can absolutely, like for a lot of women, it'll just be like, it can be just a game changer, an absolute game changer. But what my concern out of it, like seeing kind of like all of this bloom and blossom and all the, the great things around it, I also do get concerned that we use it that it gets used as a Band-Aid approach. And so kind of that original point that we were making is that it's really important to look at a person as a whole and make sure that you're not treating hormones just from a symptomatic viewpoint. You want to make sure that you're following things downstream enough to work with the patient on what is causing the hormones specifically to be an issue.
Right. Yes, definitely.
Does that make sense?
Yeah. It does to me. Yes, I think so. Yeah,
I know. I'm just thinking, I know that. So
maybe give some examples of what are some things that could really, if and I've used even that same phrasing in that talk I did earlier. I was like, HRT can be a Band-Aid approach, right? If we're not looking at, so what maybe are some root cause things that can throw off hormones that you would want to treat, right? That just HRT would not address.
So this is probably one of the most common things that I see in my practice, if not the most common thing. That is, and just so you know, for your listeners out there, adrenal fatigue. I'm going to call it that, adrenal fatigue. But if you are talking to like your medical physician and you say the word adrenal fatigue, they may say like, there's no such thing of it. And that's
Woo-woo
because
diagnosis. Yeah.
yeah, it's not really a term that's used in the medical literature. So you're going to be much more accurate to say HPA axis dysregulation. But for the term of talking to like the everyday person that's walking down the street, most people are going to understand like what adrenal fatigue means more than HPA axis dysregulation. You may get a
Right.
perplexed look. But that is probably one of the, like I said, the biggest thing that I see. And your adrenals are basically part of your stress response system. And so we know that living in today's world with a 24-hour news cycle, with the toxins that we're exposed to, with just everything that we're dealing with a lot of people are living in kind of this heightened stress response. And what that does is that taxes the adrenals. And so when a lot of women start to go through perimenopause and menopause, their bucket is kind of already full. And then that workload starts to shift away from the ovaries now to the adrenals. And if your adrenals are already kind of taxed and quote unquote fatigued, guess
Right.
what? When your hormones start going through that perimenopause menopause shift, you are going to have a greater likelihood of being much more symptomatic. So that's why bioidentical hormone replacement therapy, or HRT or BHRT, those are all kind of synonymous terms that are used. That's why it's so important that if you are a woman out there and you're going to consider using this, and you want to make sure that you're also not shortchanging the important things like your stress response system, which goes back to our self-care and
Right.
making sure that we're taking good care of ourselves, making
Mm.
sure that we're exercising regularly, that we're getting in stress reduction practices. And that's just kind of the tip of the iceberg.
Right. Definitely. Definitely. I agree. Yeah. I've even seen women, had a couple patients recently that were put on like pellets in
Mm,
their 30s, and because their testosterone was low, or might
wow.
show up, and I'm going, this isn't, and they're like, I guess I'm like early menopause, like that's what they're being told by
Yeah. Yeah.
anti-aging clinics, or things like that. And I'm like, that's not the problem. That's not really the problem. Your adrenals are like depleting your sex hormones, right?
Yeah, it's sad to me because to me, it's just such a reflection of how a lot of us run our lives. And we just basically end up kind of like driving ourselves into the ground. And what happens is in perimenopause and menopause, like the things that we do to ourselves kind of in our 20s and our 30s. And I'm going to say, ladies, if you're in your 20s or your 30s, like do everything you can to take care of yourselves now so that you don't end up with these problems as you get older. But as we do get older, it's just almost like our bodies become less, like more intolerant to it. And so the
Right.
things that we got away with before, it's just they're going to be like unnegotiable now.
Right. Yeah. So let me ask this question, just maybe leaning into more of the hormone piece. So Menopause Society does not recommend checking hormones, right?
Yeah, so I have a very different take on that, and I get
Right.
patients sent to me all the time, and I hear this commonly, and the common story that I'll hear is, "My doctor said not to check because your hormones change all the time, and so it's really not worth even checking."
So
So
what's
that
your
is
Yeah, I was gonna say, I feel like you and I probably practice the same way, but what's your response to that, and how do you
so
handle testing?
So, first of all, I always like to explain, and I know you came from a medical background. And so I always like to try to explain that it's not really us trying to like pitch ourselves against the medical community,
Right.
because it's really understanding like what tool you're picking up out of the toolbox and what that tool is for. So there
Right.
definitely is a time and a place, and especially when it comes to crisis intervention, like, hey, I just fractured my pinky recently, and I would not go see my local functional medicine doctor for this.
Right.
I'm going, to somebody that can do crisis care for my finger. I know it's not that big of a deal, but just a small example.
Yeah, definitely.
And functional medicine really is root cause medicine, which is really trying to understand what is going on with a patient. And oftentimes there's even multiple root causes. But with hormone testing, what you'll commonly hear in the medical community is what I just referred to.
Right.
Functional medicine, the difference between that and functional medicine is at the heart of functional medicine, it is very much a evidence-based type of protocol. So
Mhm.
that means everything that we do, we always do a good history. Listen, we're looking at signs and symptoms. It's not to say that those things aren't relevant, because they are, but we are always going to back things up with testing in order to warrant the clinical evidence of that particular what we're thinking, to rule things in, rule things out. So
Right.
testing is really, first of all, at the heart of functional medicine. So to me, the idea of like there's no use in testing, it just kind of goes against the philosophy of functional medicine. But to
Right.
add another layer to it is that yes, our hormones do change and fluctuate, but we can still use strategies in testing hormones. Like there are certain times that you can test hormones so that you know that you're testing hormones when they're at their height. And then there is certain testing, like the Dutch test, which is stands for dried urine test. It's a comprehensive type of test for hormones. It's different than looking at it in the blood. And what that does is it measures your hormones actually at multiple points during the day. So it is testing valuable? Absolutely. And personally, I think if you're going to be adding in hormones, you really want to test your hormones and understand what you're putting into your body and where your body is at.
I agree. Well, and again, I think you and I probably practice pretty
I know.
similarly. I always talk too about knowing what those hormones are doing in your body, right? The Dutch test
Exactly.
is so great for not just what are the levels, but then what's estrogen, what's progesterone, what's testosterone, but what are the metabolites of those and how your body
Exactly.
processing it, right? Those pieces of information are so key to knowing if there is a risk for you, and what that hormone is going to do to your body and why one person might react one way and another person another way.
Is so true. And the metabolites can be, when it comes to hormone dysregulation, like the metabolites are such an equally important part of the story. And with the Dutch hormone being a urine based test, like you can't, and it's not to say that blood test isn't useful, because you can't, but again, it's just understanding what that tool is that you're picking up out of the toolbox. And so there are limitations as far as what we can see in the blood. And so from the urine testing, we're going to be able to understand how you're metabolizing your hormones. And so if you want to put bioidentical hormones inside of you, it sure is kind of nice to know how your body, and is specifically with estrogen, with concerns around estrogen metabolism, you can see what your estrogen metabolism pathways look like on the Dutch.
Right. Exactly. Exactly. And so I guess maybe I'll just say a quick comment in case somebody's listening that's like, what are they talking about?
Yeah,
Right.
hopefully we're not
It's
going off the
I
rails.
know, right? You and I know what we're talking about, but right, we have estrogen and then our body has to process that estrogen out and we can process it in a way that can I always use the example of right estrogen toxicity, right? Where that estrogen can build
Yes.
up and become it can damage DNA and lead to, breast cancer risk, things like that if your
Yeah.
body doesn't process that estrogen appropriately, which can be a genetic thing, right?
Yeah, absolutely.
Yeah.
And so, especially if there's concerns like a woman has a breast cancer history or in her
Mhm.
family, maybe, and she wants to understand her estrogen metabolism pathways, it's such a great test for that.
Right. Definitely. Definitely. So then say, somebody cause things are taken care of and somebody is looking at, bioidenticals to help with hormone imbalance. What would be your guidance to them to decide whether HRT was right for them or not? What kind of process do you take people through?
Well, the first is obviously understanding their personal medical history. If they do have any concerns or questions that we need to go over first. Making sure, as I said, that you are supporting that. You want to be looking at blood sugar regulation. You want to be looking at, adrenal health, like we talked about. You want to be looking at understanding detoxification pathways. You want to be really looking at the person as a whole. And then the bioidenticals are really going to work the best when you're adding those in for support. Because let's face it, at the end of the day, our hormone production is going to go, like menopause is just a natural transition in life. And we're all going to go through it like it or not. Every
Yeah.
woman's experience is going to be different. And so some women you may find they say, like, oh yeah, it really wasn't that bad for me. Other women, their buckets may be fuller, and so possibly they may need more support. But the bioidenticals, really, when you add it in as a whole body approach, it really can add that kind of missing link, if you will, to really make a difference in the way a woman feels.
Right.
And we all know, like, as we get older, we don't, we want to be living our life, whatever it
Right.
is that you like to do, you love to do, whether it's spending time with your grandkids, whether it's like you got a new zest for, your career or whatever, like life doesn't stop. I
Right.
don't think life should stop for us, and, I'm, going to be 56 this year. So, I want to keep going. I want to keep rocking it.
And so what then is do you have preferred forms of bioidenticals that you use with your patients then, if that's, you decide with somebody, okay, that's the appropriate choice for them and is going to help them.
Yeah. Well, first and foremost, I mean, it's pretty much like well understood in the literature, but I feel like I still see this, whereas with any type of estrogen, you want it to go in topically. Okay. And the reason why that is because you want to bypass liver and gut metabolism, because that's where you can end up with estrogen metabolites that are more problematic, the estrogen metabolites that we don't want to see.
Got
So,
it.
estrogen transdermally through the skin.
Hmm.
Progesterone can also be transdermally through the skin, but you could also can take oral progesterone. So, oral progesterone, typically, because it's digested through the gut, you usually need higher dosages, because just as it isn't all going to get absorbed. So it's usually like, I think 15 to 20% is what the literature says. Yeah, so you're going to see women taking like 100 milligrams, 200 milligrams of progesterone, but that's not everything they're getting into their system. They're just,
Right.
getting a percentage of that. So those are kind of the different modes of application. Now, there's also pellets, which go like are injected, and there are like for testosterone specifically, testosterone injections. So anything that I do in my practice, because of the type of physician I am not a medical doctor. So I cannot prescribe anything that has you need a medical license. So the products that I use in my practice are all transdermal, meaning they're
Hmm.
all through the skin. So
Right.
a lot of women who reach out to me for the first time, they're kind of like, well, if they're reaching out to me for the first time, I guess it makes sense, but they're just starting this journey. And so they really like the idea of doing something topically, even though they have to apply it on a daily basis, it's a lot easier to control the dosage, to kind of find out where they sit with it and monitor how they do with it.
Right, right. Got it. Yeah. Well,
Did I answer
and
that?
you yeah, yeah, yeah. Yeah, I'm just talking about, yeah, preferred routes and stuff. And I do believe you, just while we're on this conversation, you have a bioidentical like guide on your website that people can go check out.
Yeah, I'm really excited about this because it's just, in the completion phases right now. But yes, I do have a new BHRT guide. BHRT stands for bioidentical hormone replacement therapy. So if you hear that word, and it does talk about a lot of what we're talking about today in a little bit more depth. And then there are helpful links inside there to some of these studies that show the benefits of bioidentical hormone therapy.
Got it. Wonderful. And so we'll put that link in the show notes, but they can go to your website, which is hopehealthwellness.com. And then I did it just before we started. They can just click on that free resources link, or we'll put the link in the show notes so they can
Okay. Yeah.
click on that directly and check out all the good stuff you've got on there. So I know, yeah, there can be so many questions. And I think too, especially if they're, some of the women I talked to last week were kind of, yeah, in that generation of, I was told, hormones increase my risk, cancer risk, just avoid them at all costs. I mean, I have family members too, like I've on my dad's side of the family, I have two aunts. I think both my dad's sisters had breast cancer. And so they, I've talked to
Yeah.
cousins that are like, nope, no HRT at all, don't want to increase that breast cancer risk. And I think there can, yeah, just be a lot of confusion and misunderstanding and to fear, it's like, oh, I want to feel good, but God, I
Absolutely.
don't want to, don't want to do anything to harm my body at the same time. And
No.
finding what's right, I think can be difficult, or it can be a challenge.
Yeah, and it's ultimately, I think, about finding a practitioner that you feel like you can trust and that will listen to you. At the end of the day, and I'm sure you're very much like this too, Lori, but at the end of the day, like I'm not into like pushing my patients into anything. I'm
Hmm.
here to like be a coach and be an advocate. And so I am very much interested into like what is the best for you. And if not ready for something or like uneasy with something, to me that is enough of a reason maybe like to the very least hold off on it, because I firmly believe that in order for healing to occur, like you want to be in a receptive position for it. It's more about empowering each other. I mean, not to sound like, I feel like that sounds a little bit like a banner or bumper sticker, but really, really ultimately it is about that, is empowering each other as women, that we do have choices. And so BHRT may be a good choice for you. And maybe you don't want to do BHRT, and maybe you want to lean into other things, and that's okay too.
Hmm.
It's more about just understanding our options.
Hmm. Right, right. Yes, yes, exactly. And do you find, do some of the people, you said sometimes people are referred over from them, or maybe they're just seeking out, maybe have you found a lot of people, whoever they're seeing, maybe in a more conventional setting, they're just not getting that, time and education and, hey, let's talk through this. Like I find, and again, this is not a us versus them because I came from the
Yeah, yeah.
conventional medicine setting, but I do find sometimes when people are seeking other opinions, it's their doctor hasn't like, and sometimes they don't have time to, but they just haven't taken the time to
Absolutely.
talk things like this out with them and help them,
Yeah,
get to that.
absolutely. 100%. I mean, I spend like, it's not uncommon for me to spend like 2 hours with an initial patient the first time.
Yeah.
And so
Wow.
we talk about all the things. And so it isn't uncommon that a woman will even come to me sometimes who already has maybe, say, been prescribed a patch in oral estrogen or oral progesterone, I should say.
Hmm.
But they're concerned because there was no testing, there was no actual like dialogue, there's no follow up testing. Or another common thing that I see is like the dosage is kind of started out high out the gate, and then the
Mm.
woman has like a negative reaction to it. And
Mhm.
so there's a lot of things that you see happening. And so by the time they get to you, you're like, oh, okay, wait a minute. We need to dial some of this stuff back.
Right, right. Yeah. Yeah. I know. And I think it's great that you're able to have that time with them, just because again, in a lot of settings they're getting maybe 10 minutes with their doctor and
Yeah.
they, just not getting the time to kind of talk through and yeah, discuss these things. So,
Yeah. And I mean, honestly, I feel bad even for the doctors because I know
right.
that doctors get involved, in healthcare, I believe, because they genuinely want to help people. And
Right.
so I don't think the problem is with the doctors so much as I think it is with the system and kind of, not to get too far down this rabbit hole, but with,
Right.
the corporatization. And it's just has created, I think, just an unhealthy atmosphere for doctor and patient alike.
Yeah. No, I agree. I agree. My experience was I, started off I practiced in the hospital for a year or like 10 years. And then I went outpatient and I went from a nonprofit teaching hospital, where, everybody got paid a salary. Nobody was, we were not a for-profit setting and it was a teaching setting too. So we, there was a lot of resources and time and education. And then I went and worked in a for-profit private practice and I was
Wow.
told, there was things I was told like you eat what you kill and, you need to see this many patients to meet your overhead, like that. I don't think I saw in a Facebook group, a woman, made a comment like, you have to pay for that for did it, just a comment about like, well, like people should just be helping you in the medical field. And I was like, that's the sad part is just not realizing like medicine is a business too. Those
Yeah.
doctors' offices close when they're not making money, when they're not profitable, when they can't pay their staff. And that's
Yeah.
unfortunate is when you're, I think again, not going too far down that rabbit hole, but when you're following that insurance model and you're getting reimbursed hardly anything for a 15-minute visit, I mean, that's I think what contributes to less than desirable care for, is that, all right, I have to see 30 patients in the next 4 hours, whatever it is, where you're like,
Yeah.
that you've got to go in, talk to them, write your note, order their stuff, in and out, bill, and you're getting from the top, see this many patients, make this much money, da da da. It's I think maybe a lot of patients maybe don't realize like that pressure that practitioners are and providers are under, especially if they're in those and even in the nonprofit setting. I mean, we were still mindful of you need to be making sure you're billing for everything because then that affects how much the hospital
Yeah.
can keep its doors open and serve people. So yeah.
I can't
Anyways, another
imagine.
tangent. We
No,
we don't
but
need to
I
go
want to
down.
but I just want to like really like I admire you so much because like you were in the system, quote unquote, and then how you have come out of that. And you're such a voice for it. And so that's that's truly commendable and I think very brave as well.
Thank you. Thank you.
Yeah.
It's a I think if we just at the end of the day we're doing what's best for people and for patients and in a sustainable way, right? That's what's most important. So I made a post on LinkedIn. You and I connected on LinkedIn and
Yeah.
it's a younger physician. I mean, like probably in his 30s physician that is at a teaching hospital. He kind of rebutted to my post and was like, medical system is a vestige of hope for so many people and how dare you say these things. And I just want to be like, yeah, I can see you're at an academic center, you're probably nonprofit, you have tons of time and resources, and go practice in a for practice setting by yourself, and then tell me like say this like that's the reality of so many practitioners. It was funny, I just was seeing other people chime in and like we're not out here trying to be bad and trying to say that the conventional medicine setting is bad, but there's definitely
No, but
there's definitely
there's
gaps, right? There's gaps
yeah.
in the care and in people getting the help that they need. And then part of it is that it's a system problem, right? It's a
Yeah, well, it becomes this
time, money,
hamster wheel.
reimbursement.
Yeah.
Mm-hmm. Yeah.
And I mean, those are the kind of patients that you and I see, right? They're people who are on that, it's that hamster wheel and they want to get off.
Right. Yeah. I just want to feel better. I just want
Yeah.
to, yeah.
Yeah.
So, anyways, we could go on, but
Absolutely.
all right. So you practice, you can work with anybody in the US, right? Or you know,
Yeah, well, since I with my functional medicine certification, it falls under the line of health coaching. So what I do is health coaching, so I am able to work with patients remotely as well. So
wonderful.
I do have, an actual office.
In
And so
person.
I do, yes. So I do have, patients that are locally that like to see me in person, but I also see patients remotely
Wonderful. Okay. And where is your location?
in Bethel, Connecticut.
Bethel, Connecticut. Awesome. Okay.
Yeah,
So if
up
you're
in chilly New
local,
England.
yes, you can go see Dr. Jennifer in person. Dr. Jen, right? You have seen on your, is that
Yeah,
what you prefer?
I go
Right.
by both. I'm so like, yeah, I'm not particular at all.
Got it. Got it. But okay. So they can check you out. We'll post obviously these in the show notes, but hopehealthwellness.com, and then can click on that free resources tab for more. And then also you've got a blog on there with a lot of great information that they can check out as well. And you're also on Facebook, right?
Yes,
Facebook at Dr. Jennifer Cardinal, which we can put all those links in the
yes.
show notes. Well, this has been great. So
Thank
thank you
you
so
so
much. And again,
much,
we'll post everything in the
Lori.
show notes. You can
Thank
go
you.
connect with Dr. Jen and check out her free guides she has on her website.
Thank you.